This is my APE presentation on my summer internship at Magdalene Serenity House. My name is Lauren White, and I'm the intern seen on your right. And there's my preceptor, Takema Staten Brooks. Serenity House mission is, I'll let you read through that. And what it is, it's a recovery home. So it's a 2-year program that provides safe and stable housing rent-free to the ladies that live there. The residents receive counseling, medical care, job and education readiness, legal advocacy, family reunification, which is super important as many of our women have children who've been displaced, transportation, budgeting, and financial literacy. What our residents do is there's 3 phases to our program. The first phase being the most kind of intense and restrictive. It lasts 90 days. That's when they'll get their IDs, their budgeting and legal concerns kind of under control. Phase 2 lasts about a year, and they have with phase 3 lasting 9 months or until they graduate. We do have an aftercare program, which I'll mention a little bit later and go into further detail at Parks Place, and they can stay there to develop rental history for 1 year after that. Here is a photo tour of our home, and they have a few living rooms with televisions. They have workout equipment. They have a nice kitchen. They have access to internet and computers, a big beautiful kitchen where they can store their food. And then they also have a quilting room, which a volunteer comes twice a week to teach them how to quilt and gives them all the materials. So who it is that we serve, there's 3 criteria that they need to meet. One is addiction, second is trauma, and the third incarceration. And they also have had to have completed a sobriety program. I will admit that most of our women are coming directly from prison system, and so they're coming to us with basically nothing, and we provide them with personal items, clothing, hygiene, all of that, and in addition to the tools to just set them on the right path. Who we are, this is Takema, a picture of her. She's our executive director. She oversees all aspects of the organization. Joy Morris, she's on the right in that photo. She's the director of development. So she handles things like our grants, research, donors, sponsorship, all those kinds of things with corporations. And I learned so much from her about that kind of thing. Liz Sims, she's in the middle. She's our senior operations officer, and she coordinates all the volunteers and the internships and the transportation tasks as well. And then Charlene Fields is on the left there, and she is our program director. So she's the resident go-to. They go to her with all their concerns and needs. She goes over their budget, helps them plan, go through the phases, and she's just a really hard worker. Here is a little clip I found on our local news station, and it's about our aftercare program, Parks Place.
Offers women rebuilding their futures a safe and affordable place to live an additional year and try to build positive rental.
It is up and running now.
Magdalene Serenity House provides safe, long-term and supportive care for women, many of them suffering from addiction and rolling out of jail.
They were having a hard time finding safe and affordable housing in the space that they wanted to live, so it didn't return into old neighborhoods, old friends. And so as part of our next phase for helping women in the recovery process, we found this house. We had a lot of community support, so we certainly couldn't have done it on our own, and now we're open.
They call it Parks Place. It opened in late January and is able to house 4 women as they continue to save money and find a permanent.
And we do have 2 women living there right now, and we have a 3rd on her way. So that's kind of some further insight into the aftercare. So how I served on a day-to-day basis, it was Monday through Friday. I worked 3 days a week from the morning till the early afternoon. I assisted them with any kind of tasks they needed around the office, including I reorganized their hobbit room, which was a supply room with all the things from paper products, toiletries, hygiene, just everything. I provided transportation to a resident in phase 1 to all her necessary appointments and errands and just regular office duties. I was able to participate with the screening and review of the new resident applications and be a part of the interview process itself, which I found really really interesting. My project won, so I realized that the ladies of the house were struggling with their budget, and there was one area I could see I could help with, and that was their overspending on food. They were dipping into their savings accounts, which was not beneficial to them. So I came up with a budget and a meal prep, which is something I utilize in my own life. I created 5 different meals they could cook and would help them spend their money more wisely and add some nutrition to their diets as well, which files in alignment with Comp 10, which is just explaining the basic principles of budget and resource management. So I presented my ideas. I coordinated a time with the staff and the residents on 2 separate presentations. One was a PowerPoint discussion, and the other was a hands-on demonstration in the kitchen. So that, ties in with Comps 16 and 19, coordinating with staff and communicating audience-appropriate public health content. So here are some pictures from my PowerPoint. It was more of a pictorial, how-to, step-by-step kind of easy to follow instruction on one meal in particular, which is the chicken stir fry, which is the same meal that I prepared in the demonstration. And then I broke down their grocery list item by item, providing them costs for each meal, and then broke it down into weeks and found that for $85 they could get 25 meals, which I found to be pretty beneficial to their budget. So here is the competencies in action, like in further detail, and which leads me to my project 2. So they distribute a monthly newsletter blog sort of thing. And so it's available for anyone to read, but it's mainly going out to people who are actively involved with our organization, like our board members, corporations, donors, grant people. So it's a specific kind of audience. I researched topics, interviewed residents, all those things fall into like Comp 7, which is, assessing the population needs. I used the data also from REDCap, which is qualitative and quantitative. It's this amazing software program created by UAMS and tracks clients' progress through the duration of a program. It's great for nonprofits. I also needed to present the needs of the women in both a positive and realistic way to the audience who are actually seem to be a little bit older in age, and they haven't really been affected by women who are involved in the justice system, which ties into composition number 18, which is select communication, audience appropriate. So I was able to complete that as well. So here are some articles that I've written that were into the newsletter. One favorite is always the resident highlights. We protect their names. So we refer to them, through anonymity, and people like to read what they've achieved each month. So that's always it's just so amazing to see all the strides that they're making. And this is another article about St. James Food Pantry that I included. Did some research there. And the ladies volunteer and receive the food boxes that they offer. So that's also great to include. Here's those competencies broken into further detail. So some other ways that I served, I created some handouts. I led morning circle for staff, which was a great way to get involved with the residents and just start their day off right. So there's me, and there's the office that I worked in. I collected UAs. I worked in REDCap and helped them with an audit. Here is one thing that was interesting, that I gathered information from REDCap. So these are the 5 areas that I looked at, and they apply to the DSM-5 module. And I looked at the data and found the mean of and analyzed the score. Let's see. So then here's some of the morning circle meditations that I included in my discussions. Another way I lead. And I guess what I learned and gained most from this was just a firsthand experience into how a 501c3 becomes to be and remains fully operational. I was able to observe different leadership roles and the functions that go along with that. I think I was a great intern because I was punctual and reliable, and I was able to see the social determinants of health in action and how they applied to this specific population. So I think here's just my summary in writing. It was just such a remarkable, tremendous experience, and I just wanted to thank Takema, Charlene, Liz, and Joy for the tremendous experience of being your summer intern. I am truly grateful. A special thank you to the ladies of the house for allowing me to be a part of your journey and sharing your lives and stories with me. You've touched my heart, and you will always have a special place within it. Thank you for letting me share this presentation.